My name is Angelito Agrilia. I'm one of the student nurse practitioner at Purdue Global. I'll be presenting my patient, Mr. Moses Sinclair. He's a 68 years old male who is seen in the clinic today complain of pain to his right hand and unable to grab or hold of things. He states that he keeps dropping things and it started 3 months ago and pain is more localized to the right hand. He reported pain never goes away when it happens every day and feels like an achy pain. Pain gets worse whenever he uses his right hand. Mr. Moses takes Tylenol extra strength 2 pills every 4 hours, and he also tried to rest his right hand but with no minimal or temporary relief at all. He endorses pain scale of 2 to 6 out of 10 for the past 3 months now. He has also no known drug allergy and denies any past medical and surgical history. He also denies recent injury or past hospitalization. His mother had a history of stroke and his father has type 2 diabetes, and both of them are still alive and they're doing well. Mr. Sinclair is married and currently works as a tailor for the past 30 years. He denies smoking or chewing tobacco, and he does drink 2 glasses of wine at least once a week with his wife at dinner time. He also denies using recreational drugs, and he reports feeling safe at home with good support system. On his 12-point review of systems, he is completely within normal limits except he has pain and weakness in his right hand and wrist that affects his job as a tailor. On his recent vital sign as follows: temperature of 99.6, pulse of 75, blood pressure of 134/64 with respiratory rate of 20. He is 6 feet tall and weighs 195 pounds with a BMI of 26.4. Patient denies any chest pain, dizziness, or shortness of breath. Upon my physical exam, he is positive on Tinel sign and Palin's test. And on my palpation to his cervical spine, it reveals no masses or tenderness with a good range of movement. His cranial nerves 2 through 12 were intact upon assessment, and all his reflexes are all within normal limits. He also has normal and steady gait on my observation. Mr. Sinclair's differential diagnosis is carpal tunnel syndrome, and it happens when the median nerve, which passes through the carpal tunnel in a wrist, becomes compressed. The other differential diagnosis is cervical radiculopathy, and this is a condition whenever a nerve in the neck is pinched and compressed, causing pain or numbness, and it radiates down the arm and to his hand. It also may cause by a herniated disc or spinal degeneration. I may also consider that he has diabetic peripheral neuropathy, and this condition causes tingling, numbness, and pain in his right hand or feet due to damage from the long-term high blood sugar, since Mr. Moses has a family history of diabetes on his father's side. The final diagnosis for Mr. Sinclair is carpal tunnel syndrome caused by the compression or squeezing the median nerve related to his nature of his work as a tailor that likely causing the pain, and due to also to repetitive movements for quite a period of time. My plan of care for Mr. Sinclair is to advise him to wear an orthopedic wrist brace to help immobilize the affected wrist, and he also needs to continue to take Tylenol extra strength 500 milligram every 6 hours, and he may consider taking ibuprofen 400 to 600 milligram orally every 6 hours as needed with food, or he may also take Maalox suspension as needed for his stomach upset. If symptoms persist, he may take the short course of prednisone once a day for 5 to 7 days to reduce the inflammation. Patient may refer to physical therapy for strengthening exercise and pain management. If no improvement in 6 to 8 weeks, Mr. Sinclair may refer to orthopedic specialists for further care. Mr. Moses also needs to be followed up in my clinic in 3 to 4 weeks for evaluation and further treatment. Thank you.